After pandemic, I think Zoom has become an in-person meeting, I believe.
Yes, that is for sure because Zoom, not Zoom, I would say COVID had been a
Right.
feature in my life.
Exactly.
COVID did not come along, I might not have thought of becoming an entrepreneur solo.
Oh my God.
And it happened because of COVID. And there are a lot of sad stories, hard stories around COVID. But
Exactly.
my personal story is something of a dream come true because I always thought I would like to be my own boss someday.
Yes.
So it just came along and it happened.
I
So
think
thank you so much. Thank you so much to Medvarsity for inviting me here. And let me just, first of all, tell a very, very big and happy Nurses Day to all the nurses who are listening here and all those who are not nurses also listening because every day is a Nurses Day.
right. Understood.
We just simply survive without them. And
Definitely, definitely.
is equally important. We are one of the most important team player in the healthcare delivery system.
Exactly. Exactly. Happy Nurses Day to everyone. Mom, happy Nurses Day. Wish you a very prosperous year ahead, I believe, because you just told me that COVID is a major contributor factor for you to become an entrepreneur. Yeah. So, Mom, we have few questions lined up.
Sure.
So I was about to ask you, what inspired you to become a nurse? Like how this journey has started.
That's a very funny one. I
Okay.
never wanted to become a nurse. I wanted to become a doctor. I
Okay.
already knew that I had to become a doctor. Now, don't ask me why I wanted to become a doctor. I can't remember. But I
Okay.
know that I could not become a doctor because I was the eldest in the family
Okay.
and from south to north. And uh, then we joined our father who was in UP. So
Right.
with a large family, when I thought I need to go back to Kerala to take my scholarship to study further, you know.
Right.
So looking at all the situation, that particular time I decided going back may not be in the best interest. Maybe Papa will be able to make me a doctor, but then he might exhaust everything by the time I become a
Understood.
doctor. I looked at
Understood.
all my siblings, I said, doesn't look like a great idea. So I just simply decided, if not doctor, I'll become a nurse. That's all. So I applied. I came to Delhi, and when during the interview, when the it's the Holy Family Hospital, which was run by medical mission sisters from US. So I was
Okay.
very lucky to get a uh, very solid, you know, training when I reached there. So Sister Stephanie, she was interviewing me. So they were testing,
Right.
you know, a little bit English and confidence and all the stuff. They were, you know, kind of trying to test. So standard question: why do you want to become a nurse? So I told her, sorry, I really don't want to become a nurse. I can't become a doctor, so I decided to become a nurse. So that day she told me, you know, child, you are probably the only one who answered like this. Otherwise, everybody else was prepared to answer, I want to serve the humanity.
Exactly.
I like to be with the sick people. I like to be like this. I like to be like that. So she told me something, and I still hold on to it even today. She told me that you have a great value of being totally transparent and honest. Keep this with always with you. It will come handy as you become a nurse. But so even after that, when the night duty came, I told myself, oh my God, is this the life? Do I need to stay awake? So really did ask my seniors. I asked them, sister, you mean that I cannot sleep in the night? I'm 17 years old. Okay. So I'm asking like very innocently that I cannot sleep in the night. So she told me, ki, child, the patients who are in the hospital, they don't go home in the night. No, they are in the hospital. Somebody needs
Exactly.
to take care of them. So a lot of such things, you know. So I would say that, yeah, I did not become a nurse by choice.
Yeah. Right.
I didn't want any particular thing, you know, just a simple thing, you know, can't become a doctor, become a nurse, you know. So that's what it is. Okay. Let's move on to the next question.
Please. So, mom, what are the biggest challenges that you face as a nurses in a COVID contest. Like,
COVID context. Okay. COVID, when the COVID came, I used to feel very guilty.
okay.
I was not at the war front. I'd
Right.
already, stepped out of hospitals in 2012 when I
Okay.
left this as the group nursing head. I left in
Yes.
2012. After that, I had been got into operations. I
Hmm.
was in training, development, and many other things. So finally, um, when the COVID struck, lockdown, I just came back home, right?
Okay.
And July 1st, 2020 is the time I floated my company. So the time between March and July, okay? So it was so painful
Right.
because so many calls I will get, can you arrange for bed? Can you arrange for
Oxygen cylinders.
so I used all my connections to make calls and try to help people. And
Right.
I've heard a lot of stories from nursing heads and nurses. And every day when I wake up, I used to feel so guilty that why am I not there? So I never had experienced a crisis like this in my life. Many other crises have happened, but nothing like this. And I have only hearsay. And my experience is like the someone who is outside the war front, you know,
Right.
someone sitting very far and trying to empathize with the people. So I got chance to talk to bedside nurses, nursing, leaders, other, healthcare leaders.
Right.
It was very sad. It was very, very painful when I had to say, no, I cannot find a bed. And by the time I find the bed, they'll say, thank you, ma'am. He's no more or she's no more. It was too painful. It was too painful. And I really don't know if I was at the war front, what I would have done. But I know for sure that when I had been a nurse all my life, whatever role that I got, I tried to play to the fullest and with utmost sincerity. Yes, that's what. So I know that I could have been that, but then uh, Providence didn't give me a chance. And I really pray that never ever our humanity have to face something like
Such
that
situations
all
again.
over again. It is really very tough for. There are upside of pandemic when you
Right.
actually look back. There are
Exactly.
upside of.
Plague situations
So
and
crisis always has two facets. It takes you to certain levels where you never thought you could. It tests your tenacity and capacity, that how much can you assert to meet the need of that hour. And then later it has got its other positive side, one of which I already told you. I'm sitting here as an entrepreneur. It is
right.
because of COVID, because I was supposed to sit at home, so I had to reinvent myself.
Right.
I'm totally a Zoom person. When someone tells me MS Team or anything, I say, can we do it on Zoom? Because I don't know, I kind of love it. So that is marketing for Zoom itself.
And I think your background look really classic.
Yeah, I try to paint this background which looks very pleasing. I have
Elegant. Yes.
a period of time. I tried this virtual background, but somehow it doesn't come out well. And
Yes.
especially, I get very irritated when my ear is missing, when my earring is ear ring is. So you say, what is happening? So I decided I'll just go natural. That is better.
So you look lovely, mom. You look lovely.
Thank you. Thank you. I did make an effort to look lovely today. And all the nurses day out there, and this is one day where you can just celebrate
Right.
being, you know, every
Being
day.
who you are.
Exactly, because
Yeah.
every day is a nurse's day. Because I totally understand, but we don't have time to, stop
Celebrate it.
celebrate being a nurse, because you do get married, no? Then you only celebrate the marriage day. The rest is all, every day is a married day. But you celebrate your marriage day. So that's it. Yeah. Okay.
Yeah. So, mom, moving to the next question, like you have said, the COVID situations were very mentally exhausted. So, how it affected mental health of nurses and what we can do to support them?
Okay. So, as I told you, I have seen nursing heads, and some nurses
Right.
going through very challenging,
Exactly.
where they were trying to emotionally adjust to that. Okay. But I had been reading a lot across the world what's happening. I'm going to be totally candid. This is my opinion, not anybody else's opinion. Okay.
Okay.
I'm getting a signal of losing my connectivity. So maybe I'll get disconnected. Looks like, I don't know. It is showing as though I'm not connected. Why? No idea. Okay. So in case I get disconnected, I'll come back quickly. Okay. That is, I'm
Definitely.
just
No.
showing us idea. So those days I used to read this, sad stories of, nurses who are not able to take this trauma.
Right.
And I still remember early days, a nurse jumping off the the bridge in London. She committed suicide. There are two, three, suicides from the medical professionals. And I always used to pick up the stories of nurses. And in India, the stark difference I found during that time, this is my assumption. I have nothing to prove, and anybody can disapprove with me. That's not a problem. So, me being in the administration for so many years, I have taken care of nurses. So, empathy is a nice word. Okay.
Exactly.
Our nurses somehow had this natural ability of not getting too involved with the patient.
Right.
In nursing schools and colleges, they train us how to remain attached and yet detached, so that you don't get sucked into the situations.
Right.
But what happened during pandemic was that something totally unexpected, lack of, beds and lack of supplies and too many patients, too many deaths. So it came as a tsunami to everyone.
Right.
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 So what I saw was that in India, at least that emotional strength, I could feel as a third party that we were not breaking down like that because you're in the battlefield. Oh, I cannot fight. I didn't get that feeling. Yeah, initial period, lot of nurses just were called back by family. No, nothing doing. You should come back.
Come back.
And
Right.
on the same side, there were a lot of people who stayed back.
Right.
And thanks to all the nursing students, thousands of nursing students, they stepped in and helped a lot of hospitals. And my experience is on the other side. So I used to wonder that how come such sad and shocking stories are coming out of other countries? Is it because that they are more sensitive, that they are not able to give the full care that they are supposed to give? Or is it because that we are more stronger? I really don't know. I saw this as a stark difference. So me as an administrator, I have a feeling that when in the hospital, when something went wrong, for example, something went wrong, a patient harm happened. So when I talked to the nurses, it was a challenge for me to make them just take the honors and say, my God, what I did was not acceptable. To see that feeling, I am so sorry that it happened. It took time. So I keep thinking that is that emotion within TK. I have to do, people have to go. I don't know. I'm not very sure. A lot of people can after this come and say, how dare ma'am we talk like that. But this is my personal experience.
Right.
Because I still feel that we as a nursing community, we can be more empathetic. When you become more empathetic, you become more careful.
Right.
When you become more careful, you become very serious about what you're doing. So every moment you spend with the patient, you are being aware that I am in charge of a life. And this is what I learned when I was 17 years old. When I had to go for night shift, I used to say, oh my God, all these people, they're all sick. If someone dies, my goodness, I am going to be, you won't believe it. I'll go with the torch in the night because we had to take night rounds. So we have to take a small torch. We have to go, hold like this and look at the patient, And all normal patient also, I will watch if he's breathing or not, because I did not know how to,
Exactly.
predict that who is more critical, or 17 years, yeah, you just exposed,
Yes.
they're putting us on night shift so that we can get the feeling of, doing the night shift, etc. So it was a totally experience, that learning that we had. But today's students may not get that in all the, environment. And then this, today we are the recipient of all the COVID batches.
Right.
They're all called as COVID batches. But believe me, even without COVID, I can remember a boy who actually came to Berkeley Healthy Dew when I was the EVP education. So we were training center. So he came and he told कि ma'am मुझे training दे दो. So I said, training दे दो अकेले? How can I do that? I said, we don't have a batch, to give you a basic training or something.
Right.
Ma'am, कुछ भी करा के, just teach me the basic. I said, why? You finished your degree course, right? And he told me, ma'am, can I be very honest? So I said, yes, I will not tell which college or which state he studied. No, I will not do that. So I said, yeah. I said, I have not seen a single patient. 4 years of degree course completed, and he has not seen a
Patient
patient.
till now.
Can I get angry with him? I cannot. It's the system that is failing him, right? It's the system. It's the people who designed this, educational, system.
Right.
And maybe the lack of rigor and vigilance that needs to get into. And we can all argue it can happen in nursing, it can happen in engineers, it can happen in all the other professions. Now,
Exactly.
the question is that should we just simply hide behind all these excuses? Or should we actually wake up and say our nurses are future and we need to do something?
Right.
So I think your question was one, and I wandered into many other places.
No, because the next question would be related to the same thing. Like you have mentioned our practical knowledge and our educational knowledge is two different things, and we always push students towards a theoretical knowledge instead of giving them a real life experience. So, what do you suggest? Things that lead a person to become a good nurse?
So let me tell you that,
I mean, what are the inspiring quality a nurse should develop to become a good nurse?
I would go back to my own story.
Right.
How did I realize what it takes to be a good nurse? Okay. And I believe in storytelling, rather than lecturing. I can give you a list of things, these are the attributes which are required for a nurse. No.
So we should start with once
Way
upon a
back,
time.
yeah, way back when I was 17, the first thing I realized was that I need to have great communication skills.
Right.
The motivation for working towards it was different at different stages of my life.
Right.
At 17, my motivation was that these Delhi girls can speak better English than me. So I
Right.
said, no, I want to be better than them. So
Right.
that was my motivation. But soon I realized when I went to the patient, I said, I need to know English, because we had a lot of, patients in single rooms, which were like celebrities coming.
Right.
So those celebrities, they liked nurses who are like good in English. So our nun sisters will also say, assign someone who knows English. So I used to say, oh, that is something special. So I need to improve English. Then I was assigned to patients who are like Hindi speaking. Then I realized for me to connect with them, I must know Hindi very well.
Exactly.
Because, I wanted to make my patients smile when they see me. And I wanted them to tell कि चुटकी तुम आती है तो बहुत, राहत होती है.
ऐसा लगता है जैसे खुशी की लहर आ गई.
Because I was short, thin, 37 kgs, and today what you see is very different. So I was like a school kid, I'll be just running around doing work, and they'll say chutki, So communication I learned was very important. The next thing was, being present.
Right.
When a patient is telling you something, be there totally with them,
Right.
not thinking of something else. I may have, maybe 20, 30 other things to be done during that shift. But when you are with one patient, why can't you be with that? You cannot be with 20 at the same time. I'm not
Right.
talking about COVID, okay?
Right.
You are only doing one thing. I'm
Yes.
only taking vital signs, or I'm only taking the giving medications or doing some procedure or cleaning him. But I'm doing something to one patient at one time. I cannot have two hands in two different patients.
Exactly. Exactly.
It's not emergency also. So that time I realized I need to be totally present with the patient, listen to him completely and try to do your best. It was
Right.
very important and it brought me a lot of blessings automatically. जो बुजुर्ग मरीज होते थे वो तो अपने आप ही बोलते थे बेटा जीते रहो, तुम तो मेरे बेटी से भी बढ़कर हो, इतने अच्छे काम कर लिए, मेरे बच्चे से भी. और दो से that age for me it was like a what we call a great motivation. I want to hear this feedback. I want to hear this feedback from the patient that they are so happy with me as a nurse. So that was my motivation. So I talked about communication, being totally present, and then listening carefully. And very important, when you tell patient, I'll be back, they'll ask you many things. You'll say, I'm so sorry, I don't know. Let me find out, let me come back. It's a commitment.
Right.
Do come back. So for me, if I tell a patient who is not my patient, let's say somebody rang the bell, I went and they asked me something and I don't know. I said, okay, I'll find out and come back. So when I come out, I'll find the assigned nurse. I'll tell, okay, sister, your patient is doing like that, right? She'll say, okay, I'll have a look. She has told, I'll have a look. But the patient remembers my face.
Exactly.
Who said that I will come back?
Yes, I'll come back to
It
it.
becomes my responsibility to ask my other colleague. I will ask Kichechi, sister, whatever it is, I'll say, have you attended to the patient? While I'm going this way, that way, I will just pop in and I'll say, sir, I hope your nurse came back and she took care of you. She will say that. So it is more about just enjoying being a nurse, being collaborative with your team members, because you have to be an excellent team player.
Right.
You cannot be an excellent nurse, just do my 2 patients, 3 patients and get away. It doesn't happen, because all patients under our care in one unit or one ICU, they're all our collective responsibility, though I will get assignments to, then the other pillars, which is not actually experienced by the patient directly, is the knowledge base. How much of knowledge you have about the patient, his diagnosis, his medications, his treatment. And can I pull it all together and come to my own diagnosis that this
Right.
is what the patient needs and this is what I should be looking out for? As you gain experience, you start learning
Right.
that a temperature of 39 for A patient and a B patient is not the same. The reason is different for both of them, right? So I have to know what is the difference between 39 in this patient, 39 in that patient. That is something I learned, and that's why probably I loved being a critical care nurse. And I opted. I spent about 16 years in critical care,
Right.
just working in India as well as abroad. I enjoyed being there because I liked thinking and making decisions, calling the doctors at the right time. So nursing, that's why it is probably told nursing is an art and a science. You cannot be a nice nurse and you don't have any science behind. You don't know that when I'm writing the vital signs in a paper, do I know what is the meaning of those numbers that I'm writing for that particular patient?
Right.
So one need to be a continuous learner. To be a great nurse, you have to be a continuous learner. You have to be a great, communicator. You have to be a great, having presence of mind. You should be having mindfulness about what you're doing. So I'm just throwing some words which is coming top of my head
Right.
to say that, and let me tell as a last line, if any one of us can become a great nurse, you can automatically become a great human being, because it teaches you to be a great
Empathy.
nurse means with patience. Huh? Very important.
Yes, yes. Understood.
Can be a great nurse without patient. There is a difference. Then
Definitely, definitely.
empathy, the kindness will not come to you automatically. So
Right.
there's a saying, no, if a human being is kind to animals, they are automatically kind to people. That's
Right.
a saying, right?
Yeah.
That if you can be kind to animals, then
Animals, you
obviously
can
you
be.
can be
Yes.
kind. So jokingly, there are some people who disagree that say it's better to be kind to animals, but not all human beings are worthy of kindness,
Kindness.
on the
Yes.
side. We are talking about patience,
Right.
patience, as we sit here today, it is yesterday or day before yesterday, a young doctor was killed by a patient in Kerala, right in the government hospital. He came for dressing. He's a teacher, and I'm just telling what is written in the media, that he's a teacher, and I think he had some trouble at home or something. So the police caught him, and he got injured in that fight at home, or he jumped a wall. So he was brought to the emergency for treatment, first aid. So this doctor was there, and the nurse did the dressing, but without any provocation, he just took the scissors and started stabbing the doctor. And those who went to help, they also got injured. But cut the long story short, she died. She could not be saved. And she's just 23 years old, just passed out medical graduate, just as young as you. And it is so shocking. It could have been a nurse. I mean, there are stories of nurses being harmed by patients and relatives. I have seen certain, violent situations. So, what I think is, as nurses, we should not be always playing the victim mentality. We need to raise our voice. We need to discuss about such situations.
Right.
I remember when we were in Fortis, we had a couple of incidents where, patient violence. So I saw at
Apologies. I'm sorry.
the front office, we had young girls, who will receive people, etc. So in one day I was on manager on duties. I got a call, "Ki, ma'am, please come." So when I went there was this some guy, some politician, I don't know who's that. He was just standing and he's arguing with this little front office assistant. So I went there. I said, "Excuse me, sir, I am the manager on duty. How can I help you?" So he said, "How can she stop me from going inside?" And then he lifted his, shirt a little bit to show a gun on the side. So I said, "Oh my God." I didn't say anything. I stayed very straight. And I said, "Sir, I'm seeing a, pistol. This is not allowed. So first let's get that out. Then we can talk." I was not very sure what he's going to do. I had no idea. But I was very firm because that is a tone and a body posture that you take. And you can imagine these guys are very tall and very hefty, and
Okay.
me like that. I was not 37 kgs, but at least I had little bit there. But I very firmly told, Then I said, I called the security and I said, "Please escort sir outside." And, there, speaking in English was little edge. When in such situation, very firmly, when you speak in English, these are my personal experience. Okay.
Right. Right.
So I said, "भैया इधर आना, सर को बाहर ले जाइए और इनका पिस्टल बाहर रखवाइए, फिर बात करें." I said, "Sir, please go. So that day I managed. But another day when I came, already people were coding the entrance. They were throwing the flower pot and this. And so I saw that my front office staff, they were actually getting exposed to anything that can happen. So
Right.
emergency, front. And
Exactly.
then, so immediately we got into action. The management got together, and then we said, "What should we do?" So then we installed panic buttons.
Okay.
So front office, we gave panic button and we gave one in emergency. So if they need help, so they
So
cannot
they can.
code purple. In hospital, there is a code purple.
Okay.
यहाँ कोई आपको मार रहे तो you cannot call code purple, no? Because
Right.
you have to be facing the person, not run away.
Yeah.
But they, like in banks, no? Banks
Yes.
also have this,
Yes.
button that is hidden that you can press. So why I told this example was only to assert that, as leaders, we need to not just feel sorry for such incidents and say, "Oh, so sad, she was young." We need to now think that, I don't know whether you will blame that patient who was not in his senses, or blame the police who was not prepared to,
Tackle the situation.
even anticipate. He could have been handcuffed. If
Right.
they could feel that he could be a danger to himself or others, He could have been
Exactly.
handcuffed.
He should, police might have taken
They'd have
precautionary
handcuffed.
measures. Right.
You can tell that, you are not arrested, but we need to restrain you. No, I mean,
Right.
there has to be something. I'm very sure there must be
Exactly.
protocol. But anyway, what I am trying to say is that even to all the young nurses sitting out here, when you see a situation, don't let it go, because
Right.
we need to learn from that situation. You should escalate. Tell your seniors that we need to find a solution. So this is called learning from errors. In
Right.
healthcare, if you don't learn from our own events, you can't have so many people making the same mistake to learn,
Exactly.
isn't it? You are 23, 24 years old. You would rather learn from others' experience. Like
Right.
your parents must have told you, don't cross the road just like that, because
Yes.
the vehicles are coming, you will get hit, right?
Exactly.
Or they will wait for you to get hit, and then you will say, oh, I should never. It doesn't happen like that, right? We all learn from our predecessors or seniors, or our counterparts mistakes. It could happen, right? So I'm really hoping that we all should have that heart to learn from our own safety events or mistakes that
Exactly.
can happen, because we all are human beings. We all can make mistakes, but it's very important to learn from our own mistakes or even from others' mistakes. So when
Agree.
I was a ward in charge in Doha and Saudi, we had this habit of sharing. When something goes wrong in one ICU, we will share to all the ICU in charges so that
Right.
we can
So the
do.
next person won't be repeating the same
Yeah,
mistake.
so it will not. So, but if we have this mentality कि मेरे यूनिट में तो हो गया, अब तो पढ़ेंगे मेरे ऊपर. Well, that is obviously somebody is going to ask, no,
Right.
why it happened, how it happened. How that is being asked, that's a different story. But then I should not keep it to myself to say, अब
Right.
उसको वहां होने दो, बड़ी खुश हो रही है ना, कल जब तू देख ले आज तेरे को हो गया. Huh? So that attitude is very self-defeating and it's very harmful to the patient.
Right.
That is not an attitude that we can afford to carry. So it's like a high risk industry like aviation and nuclear medicine, right?
Right.
Nuclear technology, where you have all these nuclear mines where they make the bomb. They don't have any margin of error.
Agree.
If you get into an aircraft, they say that you would die. There is a possibility of crash, maybe 1 in 1,000,000 flights.
Right.
But in healthcare, I'm sure everybody sitting here is a healthcare professional, so I can tell that. If the
Exactly.
patients will hear it, then there is a problem. WHO's statement, 1 in 300 patients will be harmed and they will die. By mistake, they shouldn't have died. 1 in 10 patients will get a hospital-acquired infection. Now, if all this data is displayed in front of a hospital, I do this in my training. I say, suppose you say disclaimer, enter at your own risk. 1 in 300 patient could be harmed and they can die. 1 in 10 patients will get hospital-acquired infection. Will they come inside?
That would be a difficult
And
questions
we
to
also
ask.
forget
And
one more thing, that our family members, our loved ones, even myself, can become the recipient of healthcare. So when we receive, would we like to give okay to excuses? So I always tell my nurses, it's not worth saying that, oh, this mistake happened after 8 years. I said, statistically, maybe for that healthcare, it does not make, statistically, maybe it's a very small number.
right.
But for the person in whom the harm was done, it is 100%, right? I think it's very important for all of us. These are all messages I'm trying to give to the nurses of tomorrow,
Right. Right.
because it's very important that we become safe nurses. That's the most important guarantee any patient needs. All the other frills, they come later. So when you go inside a hospital, so like one of my family member who is not a healthcare, when my sister, when she went into hospital, she said, मुझे कोई डर नहीं लगता. एक ही चीज का डर है, बस मरना चाहिए. You understand? She was going for a surgery which had hardly had any complications. So statistically, everything's safe. Huh? God forbid. Anything goes wrong, it is 100% for that patient and for that family.
Right.
There are no more statistical number to be told, right? These values are very important to be understood by any healthcare professional, not only nurses. And I personally believe nurses can do a lot of positive things in the environment that they are working, because they are the last filter for any error from reaching the patient. Where some people, a lot of learned people after research will say that it is too much to expect from a nurse. But having spent 16 years at the bedside in ICU, actually handling very, very sick
Critical
patients under very
patients.
difficult situations,
Right.
I feel a very aware and alert nurse can be a blessing to a patient, because she will stop any harm from reaching her patient.
Right.
That's why nurses are called as advocates of patients. हिंदी में क्या बोलते हैं? वकील.
वकील.
क्या करता है अपने क्लाइंट के लिए? जो सबसे अच्छा वर्डिक्ट चाहिए, जो भी सही है वो लेके आता. So same thing for nurses. When we call ourselves advocate, I should advocate for the safety of the patient.
Right.
So if me as an advocate, I only start doing hanky-panky, then there is a problem.
Understood. Exactly.
I can go on and on. Maybe you have some more questions.
So I was about to ask you, can we move to the next question?
Sure,
And
sure.
this is regarding young people in nursing as a professional. So what do you suggest, especially young women, how can they consider nursing as a profession?
Okay. First and foremost, I would say is a recession-proof profession.
Agree. Completely agree to that part.
Yes,
Yes.
recession-proof. I mean, you will never be out of job.
Right.
Wherever you are, you can find it. So whether
Exactly.
you will dream job, that's a second question.
Yeah.
But you will always have a job, right?
Right.
And if you believe if you want to have a recession-proof job, okay, nursing is the one. Second thing, you love being with people. You want to do something for others. I mean, that's the value to start,
Right.
And I would definitely discourage any young person to become a nurse just because somebody forced them. Because that can become a challenge. But for me, I didn't want to be a nurse, but today,
Right. That you told
that
at the beginning itself.
I'm a proud nurse, and I'm so happy I came into this profession. And this profession gave me everything that I have earned in my life. It has come to me, and it has not come free, my dear. It did not come free. A lot of hard work, persistence, and a lot of sacrifices. You just have to know that what you are getting into.
Right.
So in India, what happens, in nursing has, at least thanks to COVID once again, a little bit more, focus is on nursing, and people realized, इनका काम नहीं जाता, बाकी सबका काम चला जाता है, लेकिन इनका नहीं जाता. Now maybe parents are telling me, nurse ban jao.
Yes.
You will always have a job. Okay,
Job,
I think that is
exactly.
job security is definitely something you can consider. Now this is for nurses, whether girls and boys.
My apologies, ma'am, but I think we have lost you for a moment.
I thought I lost you. I was still connected. Okay, no worries. Where did
Yeah,
you
no.
go? And start from there.
I think where you have mentioned that young nurses, because they have the job for securities with them after COVID hits and people got to know, especially parents, that this professional is something that never going to out of what we say fashion in a job industry. Yeah.
Exactly. And the salaries in India may not be the best that you will
Exactly.
do
Yeah.
there.
And that's the major concern, I think.
Let us not also forget one more thing. Engineers who pass out, not all
Agreed.
of them have the same salary.
Agreed.
Correct?
Agreed.
Yeah. So the problem exists in all the professions, wherever you do a
Definitely.
professional course. But things are getting better. Hopefully, it should get better. But the world is open to you. The world is open to you. The entire Europe, US, Canada, Australia, New Zealand, name it. Everybody wants nurses.
Right.
And we are sending nurses.
So
In
broad
fact,
as well.
I heard that
Exactly.
in March, 23,000 nurses left the country. 1 month.
Within a
But
month.
only one thing I would request, all the young nurses is that please give 1 or 2 years serving the country here.
Right.
If we can have a little bit of balance, I always believe, I also went abroad because I also wanted to earn money. There is nothing wrong in that. But I went after 2 years. By the time I went, I was a professional in my own merit. I knew I had the experience. I could stand up. Nobody will say, yo, they need to be trained also. They came all raw.
Right.
Every country would have a different way of looking at, foreign graduates.
Right.
For
Exactly.
other countries, we are foreign graduates, right? So again, your communication should be, right in place. So you have to ensure whatever is written about a nurse, if you can imbibe all those values and you can enjoy serving others, and this is like a job where you serve others and you get paid. How many professions are there which is like a charity work? I always take this example. In IT and other industries, they'll say, oh, today we'll go to an old age home. Today we will go there. We will do something for them because you want to do seva for others. But this is one profession where you do seva every day.
Right.
And you get paid for it, right?
Exactly.
So it is the ethos of the profession if one can imbibe. So everything is good about nursing. If you want a challenging job, which is ever evolving, where your brain is totally active. So today I am sitting 64 years old, and I can tell you that, I am far more tech savvy than all the youngsters sitting here probably in the nursing profession. I mean, I'm not competing myself with engineers, but with nurses. And I thrive on that learning mode, that every day I'm doing something and I'm excited. So this is what I would say. It's a profession that will give you excitement throughout your life if you want to take it. At the end of it, it's your attitude. It doesn't matter whether you're a nurse or a doctor or an engineer.
Exactly.
It is your attitude that is going to take you to places. And nursing is one profession that can take you to places. And I am a Jita Jagta example. So I am founder CEO of my own company, right? And it's because I enjoyed being a nurse and I decided I wanted to stay in this profession and give back to my own fraternity. And probably that's why you have called me to this interview to say that from your own experience, say something, right? I'm okay to say anything to anyone as long as it will make a shift in the thought process or the attitude of even one nurse. I feel that I have done it. The time was well spent.
Right, right. So, ma'am, if we move to our next question, so how do you stay up to date with the latest development in nursing healthcare, and what are the resources do you find most helpful? Do upskill program help nurses with a better career prospect? Like there are plenty with online modules as well as with offline modules. So, what do you suggest?
So I would suggest is that, today, since the COVID came, I'm doing a lot of courses on Zoom.
Right,
Okay,
right,
I concentrate on leadership and critical care, infection prevention, etc. So
right.
I have learned that it is possible that you can do a longer online course.
Exactly.
And also there are sources which are available. Study at your own pace, but there needs to be an attitude for that. And also very important that in India there is a certain way things needs to be explained.
Right.
So what I have seen is, yes, you can use all the online thing. And for me, Google is a very close friend of mine. And now I have already upgraded myself to ChatGPT.
Oh, that's
So
good to know. That's really
I
good to know.
I test the ChatGPT myself and I say, oh, you're not very good in healthcare. Huh? So I put a there and I got a very funny answer today. So I told her, सब कुछ नहीं आता है ChatGPT को भी. So you need to be careful. Even when
Right.
you ask Google also, you have to learn how to ask
Exactly.
questions in the Google, how to verify. So there are so many opportunities that's coming your way that you can get someone from US to, you can do that. So, and then going out and finding the resources required. But unfortunately, in India, the nurses are, I would say that nurses are pretty much myopic. It's like कि graduation करना है,
Yes.
IELTS OET pass करना है, फिर London जाना. So at least I know of one person. No, there are two people who returned. Okay, the senior people. One person who went to UK realized that they have to start at the bottom of the ladder.
Right.
So, and she said, me being a nursing head, starting there was a problem. So the husband told, why are you struggling? Just come back. And she's back, and now she's back to being a nursing head. There's another deputy nursing head. She had gone to another European country.
Right.
And she thought she had better, of course, money was definitely better.
Right.
But then once she reached there, she realized the position, the recognition that she had back in India was not the same. So she also came back, so adjustment could be a problem, that
Right.
can happen. So the opportunities which are like online are plenty, but one need to be careful that which one is going to help you. Which one is going to help you with the career or the domain that you're working.
Right.
So definitely that's an option, because I myself, I run Zoom classes, and I myself have got a LMS where I have put some courses up there, and there are newer things coming up, and I'm a very tech friendly person. So as we speak, I am discussing with some entities on what more can technology do with nursing, because we have a lot of challenges in nursing, right?
Right. Right.
So the solutions that I found 10 years ago working may not work today.
Today, exactly. With
Because the
time changing and
so I need to do something different to get the
right.
result I want. I hope I answered your question.
Yes, definitely, mom. So moving to the next question, what advice would you give to someone who's considering become a nurse, or it just starting in their career? Like they have just in a phase of starting. Could you
Okay.
share a few tips of work-life balance? Because I think this is a new norm where we are facing challenges.
I know.
We are struggling a lot between working and being a handling personal life and professional life. So yes.
Well, I would say I'm trying to go back to the time when I was a young nurse.
Right.
I'm struggling to find a phase in my life where I thought work-life balance was an issue problem. I can't, because I always enjoyed being a nurse. But I would
Right.
say there can be situations where you are trying to balance the both. So I have had counseled, nurses. So it all depends on what you want to take away from your profession
Right.
and what do you want to balance. Because there is a saying, no, if the job becomes your passion, then you don't have to work even a single day,
Right.
right? But
Exactly.
maybe that will not be the case with all the people who are working.
Right.
So it is very important to learn that how do you conduct yourself very professionally. So in India, what happens? We lack professionalism. I'm not only generally in the hospital, in the nursing, we lack professionalism. So what happens when you work with foreigners? They are very clear. Your job role has this outcome.
Right.
We want to get that outcome. And if you
Exactly.
get it, you'll be recognized this way. It is told to you before itself, right?
Right.
Now it's up to me whether I want to get recognized at 5 or 4. So I
Exactly.
will decide. But in India, we don't have that clarity. It's never clear that what is that you are there. What is your deliverable? In paper, everything is there. Don't worry. Everything is there in paper. What is your deliverable? How will you be measured? And what will you be? The challenge will be maybe the first two will be clear. But
Right.
when it comes to giving increments, then there is plus minus that's
Right.
going to happen.
Right.
Balancing. So these things are better off there. But work-life balance, I would only say that please take care of your health, first of all.
Right.
It's very important. Youngsters, they come on duty without eating and drinking.
Right.
That's a very wrong thing. Because if you are not fit and healthy,
Yeah.
you will not be able to adjust to the challenges which is of the profession.
Right.
Once you get into duty, there is no guarantee whether you will drink water or you will go to the loo or whatever. This is challenges of being a nurse and a doctor, right? We have decided to get into the profession.
Right.
Once you get into the profession, we can't hold everybody else responsible for my work-life balance.
Exactly.
Isn't it? Yes, you have a challenge. Have the courage to speak to your bosses. You can't be keeping quiet and saying somebody is going to come and balance my work and my life.
Right.
So when some young nurses who get married and who are going to have child,
Right.
they will ask you, ma'am, what should I do? How will I balance? I said, see, let me ask you a question. Can you afford not to work? Can you afford not to work? That's my first question.
Right.
So some will say yes. I'll say, okay, then take a 3 years break. That's my experience. I took a 3 years break when I had my son because that was my decision that I want to focus this 3 years.
Right.
And for that, I had made my financials secure. So it is very important that you should be planning well,
Right.
And I also always used to tell my young nurses, I'm not asking you to carry patients home. When you're with the patient, be with them 100%.
Right. Exactly.
When you leave out, I don't care. You do whatever you want. Enjoy your life, no problem. Now, I always get confused, when someone says work-life balance. If there is a young nurse, I'll tell you, what do you mean by work-life balance? So I'll tell you, work-life balance sometimes is not managed because of people like me, leaders. So I'll tell you a story. We are also guilty of that. I will agree to that. So when we make the duty rosters for the nurses,
Right.
we don't make them participate in.
Oh.
We enforce the duty roster
Right.
on.
Exactly.
There is a way to do it. There is a methodology around. That's what I train when I do the leadership courses. There's a methodology. So the nurses feel, oh, somebody is designing my days.
Right.
Their off days are also decided by someone else.
Right.
Not in my hand. So can we make it more participatory? We can't make it totally flexible like in US. US, you can go and choose the duty that you want.
Okay.
And when you select a shift which will pay extra, that's your choice. But in India, not all hospitals will pay for double duty. They may give compensatory off. There are logistical issues which are there. So that's why I said leaders are also equally, accountable
Responsible for
this, disbalance,
Right.
And also it's like, let's say that, I have off. I have got an off on Thursday, but the hospital has this habit of calling the people on off days. Again, my time is not my time. So
Right.
is there a solution? Definitely there is a solution. That you can ask people to volunteer, that which day you would like to be called.
Exactly.
You
Exactly.
have a calendar.
Yeah.
So you know that this day my phone needs to be off.
Right.
Otherwise, forever we are complaining. I wanted a nurse. Everybody's had their phone switched off. I can't get anyone. This is a complaint that we get, right?
I understood.
So I would say that to the youngsters, I would say be aware that where you can assert, speak up to your bosses to say that, go with a solution. I always used to tell my team, don't become a part of a problem always. Become part of the solution.
Solutions.
Because current generation, they think in a different manner. So they can come up and say, this is the way, and they will surprise you. This is my personal experience. If you ask them, we have this situation, how can we handle it? They will come up with such. So the problem also lies with leaders that we don't involve them in our discussions. We don't ask them what could be the solution, because at the end of the day, hospital and healthcare are very unpredictable environments.
Right.
So when we took that profession, we are aware that it can become unpredictable. So I need to sacrifice my Christmas, my Easter, my holidays, earlier days, as you grow in your career, sometimes those become your perks, that you are off every Saturday, Sunday,
Right.
and all holidays you get, But if it is required, if I need to be in hospital, it doesn't matter what role I am playing, I'll be back
Right.
in the hospital, right? So I would say that, be aware. It's very important. What is your definition of work-life balance? be aware that how other nurses are managing their work-life balance. How should you assert to your leader what can be done to bring that balance back in your life? It will never be 100% right for anyone at any point of time. It's a manner in which you look at that particular situation as the glass is half full or glass is half empty. So these are things that one tell to oneself.
Right.
Nice to hear, but then everyone's background is different.
Exactly.
So each one has to decide what they want for themselves and what is the definition of work-life balance. As I told you, I'm a single mother.
Right.
I brought up my son from the age of 2 years.
Right.
But I know I couldn't have done it if I didn't find my help at home. Her name is Saroj. She's with me for now 22 years.
Oh, that's great.
So because of her, I could do all the roles that I played in my professional life, traveling when I was in Fortis across many cities, because as a group head, you have to travel. So I could travel all that because I was sure that she was taking care of my son.
Right.
So maybe those kind of help is required at some time. And then if a particular situation doesn't work at all for you, then you change yourself. That's what, because there is a saying, whenever there is a situation, one, you can do something to resolve the problem.
Right.
Number two, you can't do anything. The three is, you can ask yourself, can I remove myself from this situation?
The situations.
Right. It's like saying that you are in a toxic relationship. Can be with the person or with an organization, could be anything. Do you want to stay there, suffer and complain, or you just want to come out and then find a better place? That's a question that only you can answer.
Agree. So just now you have used the word recognition, that if you see abroad, the nurses are did not get much recognition, but the same case I think is in India as well. Sometimes I feel so. How we can ensure that the nurses are recognized and valued for their essential contribution in the healthcare, both locally and on global platforms? So what we can do for that?
Yeah, see, in abroad, there are associations. These associations are, supported by great companies. They institute different kind of awards with different associations.
Right.
So India is getting slightly better. I happen to be the founder president of Association of Nurse Executives India.
Okay.
We started in 2017.
Right.
Okay. And I was the president till December 2022. Now we have a new president, Captain Ajita Nair. So I'm just alluding to the, growth of that particular association.
Right.
So maybe the times are changing. We have been called even to the Prime Minister's, meeting when the COVID started, so I went personally just before the lockdown. So we are consulted, but however, there is a lot of word praise. It's like when the Nurses Day,
exactly.
World is talking about Nurses Day. But the mudde ki baat ye hai ki whether nurses are called to the deciding tables.
Right.
Decision-making tables at the top level.
Right.
That is yet to be desired in India.
Okay.
If you look at the other countries like UK and US, we see them far more progressed.
Right.
But you ask them, they are still fighting through the same battle to get the recognition. So there is not one thing. It is not about, me being recognized on a platform like this, which was not unheard of before, which was unheard of before COVID, I would say. Now a lot of, recognition, all those things are happening. But I still feel there are many ways all the industry partners and hospitals can roll out, recognition programs, which are also a little bit more scientifically based, which will propel nurses to be more, what you call intelligently showcasing something. It's not just about always saying that she's a caring nurse and this is, so so she should be given an award. But what about her critical thinking skills? Did she
Exactly.
fit in the
Exactly. Exactly.
maybe the Medical Doctors Association should start recognizing the, the skilled bedside nurses.
Right.
That way, the young nurses will get more motivated. Yeah, we are being
Exactly.
recognized. I'm sure that all this Nurses Week, all the top leaders have been called here and there to talk about. Did we see any bedside nurse being called to talk about how do you feel? So even Medvarsity can do that differently next time.
Exactly. We'll surely plan
Even
something about it.
Kidney Healthcare, I am planning to do something different because I have a track called TG's Conversations with TG. I usually call nurse leaders, but I have also called young people. So I have plans to bring in different levels of younger nurses to discuss
Right.
what do you see the future should be, because the theme is our nurses, our future. This is not only for this month. It is going to be the theme for the so many years to come.
Right.
So who is going to be in the future? Not me. It is the young people out there who are going
Exactly.
to doing things in the healthcare. So then better to involve them, better to recognize them, right?
Right.
Today, we as leaders, we have a responsibility to find opportunities for recognizing the nurses.
Exactly.
So in my own capacity, I try to do little things that I can involve the young nurses, like I have a plan. I train infection control nurses. So I have told them that we will have a, full webinar where you will be speakers. My
Right.
students are going to be speakers. And
Right.
so I'll be just there to help, I will help you. So they are all excited, they're all excited. It's not that the talent is a challenge. There
Right.
is talent. Now we need to showcase more of those youngsters' talent so that
Exactly.
more and more talented nurses can become the norm. So what happens, Hindi mein kahavat hai na, ando mein kana raja.
Kana Raja. Huh.
So the excellence in nursing is not a no.
Right.
There are many challenges around it. The
Agree.
more and more nurses become in that excellent category, I am sure that our position, our remuneration, everything will start changing. If we can
Exactly.
go to that, it's a chicken and egg story. It's going around. I cannot wait till the day to say that when my salaries are done, I will become an excellent nurse. If that was the case, I would have never reached anywhere from any position.
Right.
If I only concentrated on the paycheck, I always used to tell my nurses that you did not sign to be a great nurse for the money. Did you say that, for this much money, I will only do this much? They don't have an answer for that. So I think just striving to do your best in whatever role that we are doing
Agree.
and always thinking about the future. Future
Right.
means future is not me. Now, for me, it is not the time to think
Yes.
about me, but I'm always thinking what more can be done back to the profession. So, more and more leaders start thinking. There are a lot of leaders who are thinking like that. That's why
Right.
Annie has got a full body of, nurse leaders who want to think for the nurses and nursing future of India. That's
Right.
why we together.
Right.
So, we have our annual conference coming up in Hyderabad, first time in person.
Oh,
So
that's
we are
great.
excited to be there in Hyderabad, and it's a great 2-day event, and there is a pre-conference workshop. So I would say that our experience of hosting this has been also great because there had been a lot of industry support, I should say.
Right. Right.
So last 2 years, virtual conference also had a lot of support without much of problem. So these are all pleasant changes, positive changes. If I would say 10 years ago, if nursing wanted to have a conference and we wanted so many industry partners to come forward, might not have happened. Now, why it is happening is because nursing leaders are now getting into influential position,
Right.
decision position. So they
Right.
see them as people who can influence decisions within the organization.
Agree.
So all
Yes.
is not gone. There are a lot of good stories, but the pace can be faster so that young nurses can experience the change because they are born today. So they never experienced what we experienced. So they
Right.
need to hear from us that how things are improving and they need to assert themselves to be the best. So if at all more nurses are going to listen, I see excellent nursing students.
Right.
So excellent nursing students. But you see them after they become staff, after 2 years, you meet them again, the fire is gone. I don't know why the fire is gone. The fire within you can only be ignited by you, nobody
Exactly.
else.
Definitely. That's that.
Others can influence
Absolutely
you,
correct.
but you cannot. So I always like to tell everywhere that we can assert to become the best version of ourselves.
Right.
Nobody can become Thankam. Nobody
Definitely.
can become you. Nobody can become Sita. Sita can become the best version of Sita. Thankam can try to become the best version of Thankam. You can try to become the best version of yourself, nobody else, right? So I have repeated this in many platforms, I would say. I had multiple interviews done by other people also. I tend to use this as my last thing to say that, let's not make so many people responsible for our life.
Right.
Instead of
Agreed.
it, I am responsible for my own life, right?
Agreed. Agreed.
You decide what you want to make of it.
Agreed. So that leads to our last question, I believe. How do we see the future of nurses in the professional over the last decade? Like, how you think it's going to evolve for the next last
See,
decade?
technology is definitely going to play a major role.
Right.
And when technology is going to play a major role, the nurse's role will change.
Yes.
But it won't change from its essence. The nurses will always be there to make a difference to the patient. But you will start seeing more of technology coming in
Right.
education and in services also.
Right.
So one need to be prepared for that. One need to be ready. But we must educate ourselves on what this technology is bringing, what could be the pitfalls, and are we prepared to, meet it head on? And
Right.
maybe new ways of delivering care, not the age-old way of, same way of delivering care, maybe new methods of trying out how to deliver care to a set of patients.
You're right.
As we speak, the world is definitely looking into different ways of doing the things before COVID, but with a different pattern, a
Exactly.
different
That
approach.
I
Yes,
agree.
that is something that we are going to see for sure. And healthcare as an industry is definitely poised for all growth. So nurses definitely are going to be in great demand, but we
Right.
are standing at a point where we are short of 1.4 million nurses in India,
Exactly.
almost 4 million nurses short across the world. And as we speak, the US has put out a paper that there is going to be more resignations from their nursing workforce. As such, their average age of a nurse is 52. So you can imagine how less young people are coming in. I
Exactly.
really
I
don't know
agree.
what is the average age of nursing in India because I have not come across any study. So I really hope that in future, India will be able to do some serious, research and studies to understand this profession as a whole, not
Yeah.
just.
Geography of the profession accurately.
So where are we heading? And we have the advantage of having the maximum youngsters in our country,
Right.
which will include all nurses also, right? They are
Right.
part of that, youngsters group. So we have a lot of strength. We just need to leverage them. And these discussions can definitely go for a long time. And but personally believe action is more important than
Then
speaking.
speaking. Exactly.
Sensitization is important, but can we do some action? And me as an individual, I try to do that under my company's banner or under the Association of Nurse Executives India. We try to see that whether we can change the needle by engaging in conversation with the right stakeholders.
Right.
That's what we're hoping to do in the future.
And ma'am, to the end of the question, what was your final message for all the nurses around the world on International Nursing Day?
I can only say a very happy International Nurses Day. And I'm very grateful for wherever that you are a nurse, in whichever industry, wherever you are. I'm grateful that you chose this profession. I will only pray that learn to enjoy being a nurse so that you never have to complain about being a nurse. At the end of the day, we all are human beings. We'll have
Right.
ups and downs. But when you finish being a nurse, you should you should have the overwhelming emotion of being gratitude. So at
Right.
this stage, I have that emotion. I'm hugely grateful that I'm a nurse, and I really hope all of you will, do your best to make the best version of yourself,
Right.
and make the family, others proud that you are a nurse. I really hope that you can proudly announce to the world that I am a nurse. Things are
Right.
changing for good,
Exactly. Exactly.
and let's be very positive and very optimistic that things are going to be much brighter in the future. But it cannot be brighter unless each one of us will shine the light that we have got.
Agreed. Completely agreed, mom. Completely agreed. Thank you so much for your valuable time. Thank you so much for your contributing words.